Welcome back to the channel. Today we have a very special one-on-one consult with our new SoftWave Technology. Dr. Mike Lynch, who's our SoftWave consultant and a close personal friend of mine, is going to be helping one of my patients out with a stress fracture on her hip. I hope you enjoy.
Stand up and show me exactly where you're feeling it.
Well, okay, so I feel it's almost like this band right here.
Yeah.
Yeah, I mean, it truly is from like here to here.
Yeah.
It's almost, kind of like I can just trace it. And, in the morning it's tighter here, as I, get walking, and then as the day goes on, then it kind of morphs back
Settles
to here.
in back there.
Yeah. I gotta do things.
And I got into this because I had shoulder injury. And from Olympic lifting, it wasn't some crazy adventure, it was Olympic lifting, and I was in medical device sales before I became a chiropractor. So I was in all of those surgeries. And I told myself if I ever needed shoulder surgery, I would do everything I could not to have shoulder surgery. And here I ended up with a shoulder injury back in 2017, 2018, and then I went on my healing journey. And then my shoulder was not really improving until I found SoftWave. No one had it. There was only 4 machines in the state of Colorado, so I traveled, had an intro session. I was really sore for about 24 hours, but then I had about 2 days of no pain.
Wow.
That was different.
Yeah.
And that's when I decided, hey, I'm bringing this to my practice.
Yeah.
Comparative clinics are using Shockwave therapy. They're using this technology. Okay, so they're doing it with stem cell, with PRP, Prolo, all of that stuff, kind of before and after the treatments. Because this is going to provide like ongoing support, right? Where it's like you do Prolo, you do PRP, you do stem cell, kind of one or a couple times, and then you let the body respond to the treatment, right? Well, this is like, hey, we can do it once to twice a week for a series of 12 treatments or so. Because what I do is I'll do about 10 to 12 treatments for most people.
Like 2 times a week?
Twice a week for like 5 to 6 weeks.
Okay.
Then we give you, like for me, I give people 6 weeks off. The research shows that the maximum stem cell recruitment happens between 8 to 12 weeks. So when we do a post-treatment follow-up, most people come back 75% or better. We generally don't have to see people again unless they have these degenerative changes. We might see them once a month of like a wellness visit.
Yeah, because
right after
and I mean, I'm so hesitant on hip surgery because I know two failures.
I know.
And they're like, oh, it's the safest thing, it's the best thing, and it's kind of like, and yet why do I know 2 dramatic failures?
Yeah.
And so I'm not a fan.
Fully because we'll notice progress generally every week. Also, some people will notice a little bit of regression, almost it feels like, right? Because you're bringing more motion back to joints that have been protected. Now all of a sudden your gait might be changing, so you might actually want to increase chiropractic frequency throughout that 6 weeks, because there's going to be so much that's going to be changing.
I know that my gait has changed right now. I can feel it because I'm beginning to feel it in my knees. I'm beginning to feel it in my ankles.
Yeah. This technology is not new. Okay, it's been in Europe for almost 50 years. Okay,
I've read that.
It's the standard of care there. All right, SoftWave brought the device to the United States back in 2004. All right, so it's an FDA Class 1, Class 2 cleared medical device, and it has about 50 patents. All right, the main thing that we as chiropractors use it for is musculoskeletal conditions to accelerate tissue healing, reduction of pain, recruitment of stem cells. Okay. Like I said earlier, it's the same technology that they use to break up kidney stones, so it has a pretty profound impact on breaking up scar tissue. Okay.
Oh, nice.
Yeah,
okay.
so that's like one thing, especially post-surgery for you, for any patients, breaking up scar tissue, right? Accelerating that tissue healing within that tissue that's been impacted through the surgery. It's going to increase blood flow by on average of about 300% because it does actually create new blood vessels through a process called angiogenesis. So it sends oxygen-rich blood back to injured, unhealthy tissue to actually help things heal. All right. Okay. And then it's the most cost-effective, non-invasive way to promote stem cell migration to the area of treatment, and it does that through a process called mechanotransduction. When we do this, when we're over healthy tissue, you won't feel it. Okay. When you're over irritated, inflamed tissue, you will feel it. Okay.
So really, really bad, or like what to brace?
It's tolerable. It's tolerable.
Just uncomfortable.
Yeah. It feels like we're tapping your bone with a hammer. It's kind of a bizarre feeling.
Okay.
Yeah. You'll realize exactly what I mean when I say that tap feels like it feels like we're hitting your bone with a hammer when you feel it. Okay? But it's totally tolerable. We want your discomfort level to be about a 4 to 5, so you just have to communicate with us.
Okay.
What you're feeling, how you're feeling. But here's what it looks and sounds like.
Okay.
Okay. All right. So what we're gonna do is have you lie on your left side, facing that way.
All right, I'm ready.
Let's go.
Yep, I'm feeling it.
See what I mean?
Yeah, I feel the hammer.
Yeah.
Yeah,
Right through there.
yeah,
Okay.
yeah. You're finding them.
Fine and all. Okay. Alright.
Which is good. We'll hit it
Yeah.
from every angle.
Yeah.
Okay, that's totally tolerable.
Okay. All right. That's good. So it probably wouldn't go down in it, right? So we found a sweet spot for her. She's feeling it, right?
Like 11.
Yeah.
Oh yeah, I'm feeling them.
Feel that through there.
So it's all around the femur head.
Yeah. Just all
Yeah.
over that
Oh, I'm
acetabular.
even feeling it there. Oh yeah, that's probably the most
The
intense.
worst. Okay.
In front, anterior.
Got front there.
Yeah, that's been the most intense so far.
She's running away a little bit from it.
I was like leaning into it a little. It's like, all right,
Yeah, like right
yeah, yeah.
through here.
Up there too.
Okay. So you can hit that acetabulum from any kind of angle.
Yeah.
So, but also the tissue surrounding the hip joint, the hip capsule, is going to be tight, right? So bringing blood flow and allowing the tissue to actually move better, which is going to free up some movement in the actual hip capsule as well.
You know, interesting. Like as you go the passes, it doesn't hurt
Less.
as much. Is that kind of what happens?
Exactly what's happening.
Yeah, because now it's kind of like before it was much of a tighter.
So let me wipe all this stuff off.
I'm so excited. This is such a happy day.
Well, we'll see how you feel when you get up.
Yeah, let's see. Let's have you stand up. I know this room's not huge, but let's have you walk around a little bit.
Wow. No. No.
Video.
Well, she's wearing underwear.
I don't care. I don't care. This is
Feel good?
amazing.
It really does feel totally different.
That's so cool.
No, it feels so much different. Oh my goodness. If this is as good as it would get, I would be happy.
Well,
But it's gonna get even better.
we're gonna do more.
Okay, I gotta hug you too.
Yeah, I'll take a hug. Yeah, I'll take a hug. That's
Oh my
It
god.
goes in from
Yeah.
Mike hounding me. No, I'm just kidding. I actually texted him.
Explain the difference of what that feels from beforehand.
Oh, okay. Let me just do another walk. So
Alright.
the difference in walking is I probably have a slight limp, but I don't want to limp. I don't feel the mental protection of this area. In fact, it's like, no, I'm good. I'm good. There is such a relief in here. It's amazing. But everything, I mean, it's amazing. I want to go out for a walk. I'm going right out and making appointments now.